Gentleman from the 19th District, Representative Walsh.
Thank you, Mr. Speaker. I feel compelled to speak on this bill, and it's not to protect insurance companies, although I understand some people have the impression I do. It is to protect the people of my district. And what the people of my district have seen through several generations of efforts at both the federal level and the state level to improve access to health care has in fact been the opposite. And what the people of my district have seen, and I've got one of those counties in my district that almost went bare recently, had no one willing to offer individual coverage through the exchanges. What they've seen is an inexorable drift toward insurance, so-called, that actually provides them no local services. And all that we've discussed before on this matter is in this bill again. What this bill will do to the people of my district is provide them a card, is provide them some form of health insurance in name that doesn't actually provide them access to health care. Because in the reimbursement scheme that's part of this plan, providers will continue to be under-reimbursed and facilities will continue to be under-reimbursed, and the drift of facilities and providers out of rural Washington will continue. We've tried to amend this bill to address some of the underlying economic realities that are creating this drift, and we weren't able to put those amendments onto the bill. But I ask you to consider, Mr. Speaker, that if we are subsidizing or potentially subsidizing insurance to the point to families that are 500% of the federal poverty line, we're no longer providing care to the indigent. We're no longer providing subsidized care to people from poverty. We're doing something to try to redesign the entire method of delivering health care services. And that is not something that we in this chamber, frankly, are good at. And I'm concerned that our efforts here will only continue the problem. In economics, we call it Gresham's law. Bad money drives out good money. And these bad policies that don't really offer access to health care drive out good coverage, the sort of coverage that the good lady from the 26th just mentioned a bit ago. We need to change the direction of our reform of the delivery of health care services. In my opinion, we need to go to some kind of system that more clearly assigns and prices goods and services offered through our health care. This plan does not take us that direction. This plan tries to subsidize from your left pocket a thing you're buying with money from your right pocket and telling you that there's a difference to you in the total price paid. That isn't so, Mr. Speaker. You can't subsidize with tax revenues a good or service that people are paying for with a so-called health insurance plan. It's magical thinking to believe you can do so. And in the realm of economics and finance, it's Enron accounting. This bill will not help the people of my district have better access to health care. And for that reason, I'm a no, and I'm asking you and all of us to vote no on this bill. Thank you.